We talk a lot about the state of the mother during pregnancy and how that might impact child health. And I'm so curious, could you clarify the mechanisms by which maternal stress during pregnancy and maybe postpartum can influence obesity risk?
So that's a really good question. Stress in general is going to impact the child uh, due to where the stress is coming from. Is that stress because of food insecurity? Is that stress because I don't have enough money to make sure that I'm taking care of the child? Is that stress because I have to pay 375 for lunch and I haven't completed the lunch application? So stress alone can make it very difficult for parents. Repeat the question for me.
Um, During pregnancy and postpartum.
Okay, how does stress impact the child?
Yeah,
Doing str-
there's a follow-up question that might be easier to tackle. How does stress biologically shape appetite regulation and metabolism in infants?
Stress. Okay. So the way that stress impacts infants and children is through the cortisol pathway, right? So if you're highly stressed, and this works with children, adults, infants. If you're highly stressed, your cortisol levels are going to be high. Same thing if you're not sleeping. That cortisol drives you to want to eat. It gives you cravings for sugar. And if you are able to resist it, hey, but most people can't. And therefore you're eating, that in turn deregulates you, and then it becomes this vicious cycle. So it's through the lens of cortisol.
And with cortisol in mind, or even any other hormones, is there a relationship between maternal mental health disorders such as depression and anxiety and childhood obesity, even
Mhm.
whether it's biological or mediated through feeding behavior patterns?
Yeah. Um, so I mean, of course, usually the way the biology of maternal mental health transitions to children is through genetics, right? And so if I have a genetic condition that makes me more likely to be depressed, and then that child has the genetic condition, they're also likely to be depressed or have other issues. But then it's also just how can a depressed mom who's not treated really, really take care of a child very well, right? And so sometimes those children are fending for themselves. They're walking down to the corner store and getting whatever they can to have a snack after lunch or after school. And as a result, it may not be the healthiest. And so that in turn can also increase the risk of obesity.